I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. For so many in Northeast and Central Wisconsin, ThedaStar serves as an iconic reminder of the overall care that ThedaCare provides. No one ever wants to contemplate the worst happening, but it is comforting to know that when you need care, we're here. ThedaStar's experienced team have completed more than 15,000 patient transports across the ThedaCare service area since the program began. It's a true testament of the way ThedaStar provides a link to exceptional care and peace of mind for our region. Perhaps retired ThedaStar flight nurse Pam Whithillen summed it up best.
When you see ThedaStar in the air or hear the helicopter, I hope that everybody realizes there's a dedicated army of people out there that will drop everything in a moment's notice and be there for you. And when you hear those blades slapping the air, that hope is on the way for somebody.
ThedaCare is invested in the communities it serves. That's remained unchanged since the first hospital opened in 1909. Today, we're taking a look at local care and the critical connections ThedaCare provides for our communities. We'll start with the trauma program at ThedaCare Regional Medical Center, Neenah, and learn how it serves as a hub for our entire service area. Joining us first to discuss this topic is Dr. Georgen, a surgeon at ThedaCare. You've been with the organization for decades, been providing care in our area for a very long time. You were also instrumental in helping bring ThedaStar and the trauma program to ThedaCare Regional Medical Center. Neenah, thanks for being with us today.
Happy to be here.
Okay, to get us started, we are going to play a little game of trivia to see how well you remember the start of the ThedaStar program.
It's way back.
It is way back. All right. So our very first question in this multiple choice series here, what year did ThedaStar get its start in Neenah? A, 1985, B, 1986, C, 1987, or D, 1988?
Well, I remember this very well because this was a game changer for our community. And my hair was brown and not gray at that time. I got a lot of nice sleep, but 1986 is when it all changed by having a helicopter being able to help our community.
You are exactly right. All right, first one down, you got it. Question number 2, since the beginning, ThedaStar has completed around how many flights? A, more than 5,000, B, more than 8,000, C, more than 10,000, or D, more than 15,000 flights?
Well, having been here almost 30 years, it has to be greater than 15,000.
You are right. D is the correct choice there, more than 15,000 flights. Our third question here, you're doing really well, by the way. Good job.
The pressure.
Yeah. I know. We have 3 more. Let's see if you can get these.
No.
All right, third question. Approximately how many flights does ThedaStar log in a typical day? A, 2, B, 4, C, 5, or D, 6 flights?
Well, average. I can certainly know there's been days we've had more than 6, but I would say average, probably a little over 2.
Okay, that is correct. A, 2. Question number 4. When ThedaStar launched, how many other air ambulance programs were there in the state? A, 1, B, 2, C, 3, or D, 4?
It would be 2 because when we launched ThedaStar, it was very important to have aeromedical transport in our neck of the woods because there was no aeromedical transport at that time, so it would be 2.
You are exactly right. 3rd in the state, first one established north of Milwaukee and Madison. So really important in our area.
Very important.
Okay, he's doing well. Let's see if he can get this last question. Question 5, how long on average does it take ThedaStar to depart for a service request? A, 7 minutes, B, 10 minutes, C, 15 minutes, or D, 20 minutes?
Yeah, and that's a tough question because it's very much related to weather, what time of year. But one of the things I've been very impressed with is how fast they can get out. So I would go with 7 minutes just because I know how quick they can go.
You are right. 7 minutes.
All
okay,
right.
Dr. Georgen is an ace at trivia. Winner, winner for Dr.
Yeah,
Georgen.
there you go.
Thanks for playing.
You're welcome.
Now we want to talk a little bit about the history of ThedaCare's trauma program. Early on in your career, you helped build the trauma program here at our Neenah campus, go on to later become the very first Level 2 trauma center north of Milwaukee. What was that like for you?
Well, it was exciting. One of my goals when I relocated from training in Chicago to northeastern Wisconsin is have the vision to create a trauma center. There was a crying need in our area. Prior to our having our trauma center, people would be going all the way to Milwaukee or Madison, which they're not close. And time is everything in trauma, and having long delays and long transports oftentimes is the difference between life and death. So having this type of trauma system, the capabilities to take care of the people who are severely injured, I knew was going to have a big impact on the community.
That's so important, right?
Oh, absolutely.
Now, building the trauma program involved recruiting some top surgeons and creating that vibrant rehabilitation center. It also included raising money for ThedaStar. So how do those resources that we now have impact Northeast and Central Wisconsin?
Well, all of those are huge factors. You could have the greatest facility in the world, and if you don't have the people to take care of the patients, starting from the nursing staff or respiratory therapists and obviously the trauma surgeons, but all that coming together is tremendous. Our area is somewhat unique. I mean, everybody thinks of the Fox cities, everything is fairly close, but we serve people way outside of that area. We take care of those folks out in Waushara County or Green Lake County or Shawano County or along the lakefront where the clock is ticking when they're injured. And to be able to have the communities to come together along with business leaders and ThedaCare to have a aeromedical transport system is huge. There have been thousands of people's lives that have been saved by having ThedaStar being able to transport patients from the scene or from a smaller hospital that doesn't have the resources to take care of those patients to our facility where you could get definitive care.
What an incredible impact.
Yeah, it's amazing, as you go through your career and you run into people that, they look up in the sky and they see ThedaStar going by and they know probably one of the biggest reasons they're still alive is because of that helicopter.
It's incredible. It truly is. Now, finally, some big changes happening here at the Neenah campus, $100 million modernization project. It's going to provide some greater access for the trauma care program. What does the future look like here?
Well, it was much needed for sure. We've become a very busy trauma center, as you know. So in order to deal with that kind of volume, we really needed to ramp up our facilities. And this building project impacts a lot of things in healthcare, but certainly the trauma program. We're sitting here on a brand new helicopter pad, which is literally a stone's throw from the emergency room compared to where we were. And again, time is everything. So to be able to get from point A here into our trauma room where we can start delivering life-saving care is very, very important. Having large, spacious rooms to work on folks when they need our help. Having imaging, specifically CAT scan, right through a door where we can just roll in there and get that done. Because again, we're on the clock. We know if we can provide definitive care within 60 minutes of when you're injured, the chances of you living through this go up huge. So it's going to have a huge impact on the care we're able to deliver to all the people throughout northeastern Wisconsin.
Incredible. Thanks so much, Dr. Georgen, for joining us today and for all that you do for our communities.
Thank you.
Next, we'll turn our focus to closer to home care. ThedaCare serves 17 counties across Northeast and Central Wisconsin with many rural areas. And we know that rural residents have different needs and their own challenges that we need to address. And ThedaCare believes someone living in a town of 200 should have the same access to care as a person living in a city of 200,000. And that dedication led us to pursue and complete the expansion of the emergency department here at ThedaCare Medical Center Berlin just 2 years ago, celebrating our 2-year anniversary this July. Tammy Bending is the Vice President of Critical Access Operations at ThedaCare Medical Centers Berlin and Wild Rose. Tammy, welcome. Thanks for being with us.
Thank you. Thanks for having me.
So you're talking about this expansion project here in the ED, 2-year anniversary. What was that project like and what was the need for that?
So it was really important to the community that we be able to invest in our community, our commitment to the community, and having emergency medical care here, keeping that local. We needed a state-of-the-art facility. Our former area, we weren't going to be able to grow. And of course, growth is what we want to do, but we also want to bring it to a modern era. So very important for our communities to be able to continue to access us in a modern setting.
And like we were talking about, rural areas have kind of a different need than other areas that we might serve. Can you tell us a little bit about how this area in the ED was designed to fit the needs of this community?
Absolutely. We have a lot of agriculture here, a lot of companies that use chemicals, and the reality of having a chemical spill or somebody being exposed to chemicals is real. So to be prepared for that, we put in a decontamination room here. And that way people are able to come inside, be decontaminated inside, and then go into the emergency department. Formerly, we had to have a tent that we set up outside. And as you know, Wisconsin winters are not friendly. So whether it be 30 below or, 80 degrees, we would have had to set up a tent for decontamination. So that's been really important for us. The expansion of our garage, our former garage, patients were in the elements. We had to either open doors to get them out depending upon what the day was like, or our rigs had to move forward and also be in the elements to be able to get a patient in. Now they're inside and we have 2 rigs. One of the other things too is our view of our patients. It's really important for our staff to be able to see what's going on in patients' room for their safety. And with this new design, they're able to do that. As you know, Cass, behavioral health isn't just limited to rural health. And as we see an increase in behavioral health, we looked at how do we keep those patients safe. So we did implement 2 behavioral health rooms. Everything in the room is set up so those patients are safe. If they're having a crisis, they're safe and they're able to be taken care of here until we're able to get them to a even safer area.
Again, all small pieces and updates that were really needed for this space.
Absolutely.
Now, our rural hospitals, they play such an important role in the overall ThedaCare organization. Our critical access hospitals allow people to get care close to home, and when they need maybe more comprehensive care, they're connected to the regional medical centers in the larger locations. Can you talk about how important that is to be able to have something like this available here and be connected to a larger system?
Extremely important. Our community can come to our local hospital. They don't have to drive further. And if they need more comprehensive care, we're able to get them there immediately. We have definite protocols. People who may be having some type of serious crisis, we can get them. We have a great relationship with our Nina and our Appleton hospitals. So patients can come here and don't have to think about, boy, I need to bypass because I'm not going to get that care. Berlin is also, along with our other rural hospitals, is stroke certified now. And we're very, very proud of that and able to stabilize those patients who might be having a stroke event and get them to our regional hospitals.
All right, Tammy, thanks so much for being with us.
You're welcome. Thanks for having me.
Let's focus on more local care, down to the level of our school districts. Our licensed athletic trainer program through ThedaCare Orthopedic Care serves 18 school districts across northeast and central Wisconsin. The program serves nearly 13,000 students. Alison Kramer is a licensed athletic trainer with a Menasha school district. Thanks for being with us today.
Thank you for having me.
So, licensed athletic trainers are often called LATs. They do so much more than people realize. So, can you start off by telling us a little bit about the scope of your work?
Yeah, so I typically work with the athletes. I specialize in the treatment, rehabilitation of athletic injuries that can range from scrapes and cuts to sprains and strains, broken bones, all of the above. They're coming into my athletic training room to see about their injuries.
And you've probably seen it all, right?
Oh yeah, oh yes.
Okay, so LATs provide, really emergency care as well. That became big news last year when Buffalo Bills safety Damar Hamlin collapsed during a Monday Night Football game. Can you talk about, the things that you do and prepare for emergency care situations?
Sure. So all the high schools, we all have an emergency action plan. The coaches have their roles in this plan. If an athlete's going down on the field, everyone knows what they're supposed to be doing. We have the radio, so I'm calling up to our athletic secretary. We're getting 911 here. And then all the other coaching staff, they're coming onto the field to see if I need assistance as well.
Do you think that creates a peace of mind for just the coaches, the students, and probably, parents sitting in the stands as well?
I would, yes, absolutely. I feel that everyone appreciates having the athletic trainer on the sideline because we know what the next steps would be if something bad were to happen.
Okay. Now, if that were not enough, LATs also provide different types of support for their student athletes, mental health support, and also getting them connected to other care that they might need. Tell us a little bit how you refer care if that's the option that's needed.
We have access to all of our orthopedic doctors' schedules. So I can go onto their schedule. I can find a time slot, and I'm able to actually put the athletes into the time slot. In addition to that, our team doctor, Dr. Connor, he will make school visits. So he comes to the school to evaluate an athlete if we find it's warranted, if we just need a little help to figure out what it is, or if we just want him to take a look so that we could avoid a doctor's visit.
Now, with parents, that's probably a great option, right? Because parents have really busy schedules. So having that coordinated and connected care probably a benefit for them, right?
Oh, yes, absolutely. Because, if we can get that diagnosis in flat, then we can start the rehab and get the injury taken care of quickly.
And that really helps get the student athletes back to doing what they love.
Yes.
Oh, really important for them. All right, Alison, thanks so much for being with us. We appreciate it. And thank you for joining us. At ThedaCare, we're proud to provide comprehensive local care to the people of Northeast and Central Wisconsin. To learn more, visit ThedaCare.org. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.